Welcome to Health Talk. I am Dr. Morgan. I'm a family nurse practitioner. I am waiting for Mr. Clarke to join. Hope everything goes smooth today. Okay. Hi, Jesse. I'm
Hey,
not seeing you as yet, though.
yes, going on.
Hi. How are
Yeah,
you?
I'm good. Nice to see you.
Nice to see you. Are you
Uh,
hearing me clearly?
yeah, man, you're good to go.
Okay. All right. So today we're on Health Talk, and we will be talking. I'm talking to Mr. Jesse James Clarke. Let me give a brief introduction of Jesse. Jesse is a junior shadow minister of health and wellness in Jamaica's People's National Party, and is currently a doctoral student in the public health degree. He has a master's of science in food and agro-processing technology, a bachelor of science in medical technology, and he has also done a few research, such as he has done a research on coconut oil, ackee oil, water quality, coconut water, and urinary tract infection in women. He's also a lecturer at the University of Technology in Jamaica in the College of Health Sciences. Welcome. How are you today?
I'm good, thanks. A pleasure to be here with you, Doc.
Okay. So I've
Yes.
decided to use my social media platform to educate, inspire, and motivate people. So today we'll be talking about a very heavy topic. I've seen you discuss this many, many times. So I know that you're very, very passionate about it. And I'm also passionate about it because I am one of the culprits. So we'll get into it. So we'll be talking about the attrition of nurses from Jamaica to first world countries and other Caribbean countries. So even though nurses left Jamaica to go to America, England, they also left to go to other Caribbean islands that pays better than they do in Jamaica. So I'm thinking about this topic because the post effect of COVID pandemic has resulted in a shortage of nurses all over the world.
Mhm.
So right now in America, we're seeing a lot of hospitals scrambling, trying to find staffing. So to begin, when the pandemic hit, a lot of nurses resigned because they were unsure of, what COVID was. They didn't want to deal with it, and some of them were at close to retirement, so they actually went into early retirement.
Yeah.
Some nurses also died. Condolences to them and their families
Yeah.
and co-workers as well. And those who remained at the bedside experienced some very, very poor treatment from hospital administrators in terms of, reusing masks, not having the proper PPE to use. And during the pandemic, they actually walked away from the job and started signing contracts with travel agencies. So for instance, nurses have left Texas to work in Florida, California, whichever state, for more than what they were paying them as full-time nurses in their hospitals.
Yeah.
So with that being said, these hospitals now are reaching out to recruiting agencies to find staffing. And once this starts happening, they're going to start looking into the Caribbean to find experienced nurses to fill this gap. So what if they should come to Jamaica? Because Jamaica is a very lucrative place. American recruiters have always been in Jamaica recruiting nurses. So my question to you is that if you were the Minister of Health, what system would you put in place to ease the attrition of nurses from Jamaica without violating the nurses' personal rights and choice to explore other career advances overseas, or place unnecessary restrictions on them? And how would you negotiate with these nurses to present an enticing offer that they cannot refuse?
All right, thank you very much. I must say that I'm very happy to be here, and it's good when we have persons willing to discuss these issues that are facing healthcare, generally speaking, and to get both sides of the viewpoints on both sides of the coin. Just to paint a picture about what is happening in Jamaica currently in terms of what is the main factor that we have pushing nurses away from the Caribbean, from Jamaica especially, is because of the compensation package that they currently have. That's flat out the main reason. And it's not only the compensation package, because the work environment is also an issue in terms of not having all the equipment that you need to do the job that you need to do. And the public, most times when they come to the hospitals or the clinic and they can't get the kind of care that they want, they're not going to cost the government, whichever one is in power. The nurses will face the brunt of that. And it's right across the board now in healthcare. So not only the nurses you have leaving, you have the med techs leaving, you have the doctors leaving too as well. You have your public health nurses leaving too as well. Everybody's leaving. So what you have happening, because the compensation is so poor, you have some nurses know what some nurses currently do is that in the summer, they will take leave and even no pay leave in addition, and they will go and come to the States and work, and then they will return after that. And most times they do that like probably 2 times. You won't get them doing it a 3rd time. By the 3rd time, they are gone completely. And you have nurses who, even though they have not been recruited into a nursing job, they leave Jamaica. So they go to Hart and they get a certification, and they use that certification to get into other countries like Canada or whatever the case might be, and then make the transition there to re-enter back the nursing field again. So a lot of our nurses you have leaving now. So the students that are leaving nursing school, for the most part now, a lot of them, they're not even waiting to get experience now anymore. They're finding one way or another to leave. And because these recruiters now are so desperate, normally they require them to have 5 years, 3 years experience on. That is not the case now. They're kind of relaxing that now. So you find that you normally back in the days ago, going to ward at the hospital, your matron would be somebody who was like a senior nurse who has been in the job for 25 years, 30 years, lot of experience. That is not the case now. You go on the ward, the matron could be someone that left school like probably 2 years or so. And she's probably on her way out too as well. So it has changed the landscape totally. So what I have been advocating for is coming off the back of, one, the knowledge of the compensation package and the research out there about employees generally, what appeals to employees, what makes them stay with an organization. And the Harvard Business Review published our research project that they did recently. And it's saying that compensation is very important. Actually, it was number 1. But the next thing that actually was a big factor in determining how bad your attrition rate will be is how, if workers feel that you're interested in their personal development, so the development of their personal career development. So for example, if you offer, is this company offering training? Can I move up from being a regular line worker to becoming a manager or a supervisor? Can I grow in this job? And that is also a major problem that we are facing. So to tackle those 2 problems, one, the first thing that we suggested to the government was, this is what you should do. You will never be able to stop it 100%, stopping nurses from leaving. You'll never be able to do that. Because sometimes people just want a different environment too as well. And you can't blame them for that. They want to experience a different country. But what you should do is fund the education of your nurses who are currently in university, and then you can come to some sort of agreement with them, whether they'll be here they should serve 5 years in the country, whatever the case might be. And not only the nurses that are currently being trained or the healthcare workers that are being trained, but also those nurses that are in the system already. You can say to those nurses who are in the system already, who have interest after working in the system, have an interest in a particular area of nursing that they want to specialize in. Say to them, no matter where in the world, you need to go to study. Because sometimes to specialize is not a lot of, you don't take about a time to study. You say to them, okay, you want to become an operating theater nurse? We'll give you the time and we'll fund it too as well for you to go and study on the condition that you return to us and you serve us for a particular period of time again. So that's what we have been saying, because when people feel like you're interested in them developing and growing. So you could have a nurse that decided, okay, I have an interest in pediatrics and I want to focus on that. You train her in pediatrics, and that will also guarantee you a quota of nurses for a particular period of time. So you can plan ahead now. So if somebody said, okay, I've served out my time, I don't want to stay in Jamaica anymore, you will already have their replacement in place. So you won't run a case now like what we're facing, we have a shortage of doctors, shortage of everybody. All the healthcare workers, they have a shortage of them in the healthcare system. So now you go to the hospital, you can be admitted to the hospital for days and not get any the care that you need. You know, and the patient to healthcare worker ratio is now extremely high. So that is now something that you have to, that's one way. The other thing that we suggested to as well, and that would also help to ease the burden of having student loans to repay and all that, give you a good start in life too as well, right, with that. The other thing that we suggested to the government to do was to provide other incentives. So for example, you have a nurse who signed up one time and decide they want to extend the time that they stay with the government. You can say to them, okay, we are going to offer other incentives. For example, nurses work all kind of strange hours, and sometimes they're on call too as well for emergency duty. So you give them special concessions, not the regular vehicle concessions that everybody else gets, but to make some sort of special concession for them. So so once somebody become a nurse, it's easier for them to own a vehicle. You also give them special loan rates for mortgages for houses. So you say to them, while these are, whether it's interest-free loans, are extremely low, lower than for the regular population for them, and you increase the amount of money that they're able to borrow from places like the NHT and so on. And you say to them, okay, and you also can create housing schemes that are dedicated to what they want to call it civil servants or to healthcare workers. You know, so those are ideas that we put forward to the current minister, and those are ideas that we will be willing to execute if we ever get that opportunity to.
Wow, Jesse, it looks like we're gonna have to promote you to Minister of Health. I'm not sure the minister, because you have raised some valid points. Some valid points. Housing is one of them that I was looking at.
Yeah.
Cars, because I don't believe that in 2022 nurses should be at the bus stop waiting on bus to go. It look bad. It really look bad. Nurses should be able to afford a house, several houses, with the amount of work that they do and the dedication that they put into this profession. And for those who remain in Jamaica, I consider them very patriotic, because you know, how do you remain when you have such a skill that is so marketable and in such a demand overseas? So we have to commend those who stay.
Absolutely. It's really a sacrifice for them and their families too as well, you know, that that they decide to stay and serve our country. And we can't take that for granted. There's a verse in the Bible that says you must not muzzle the horse, muzzle the ox that is treading out the corn, or something to that effect. Basically, you must oppress those whose backs there's blood, sweat, and tears you're building on and you depend on. So our nurses and our healthcare workers, those are that's the backbone of the country, and we continue to take them for granted, and we are going to pay a very well. We have been paying a very heavy price for it, because what you find happening now, we have a backlog in surgeries, not only because of the shortage of personnel, because we're short on theater nurses now and all of that, but also the poor maintenance of our operating theaters that we have in the public health system. So you find that we have a backlog of thousands of surgeries, and these are important surgeries. So just imagine somebody has get some sort of abnormal reading on like a pap smear slide, for example, or prostate PSA, abnormal PSA reading, and they need surgery to intervene as part of their intervention. And you're on a waiting list for over a year, 2 years, 3 years.
Wow.
It don't make any sense.
So that is not even bad, Jesse. My granduncle had a heart attack, and he went to the hospital, was treated, and sent home to get an angiogram. That's something that you do right there and then when you have a heart attack. So he has not gotten that angiogram done.
We do not have one functioning hospital on the island, fully functional. We don't have one. KPH, which is the leading hospital in the region, not only in Jamaica, in the region, because if you have emergencies at some of the other small islands, they fly them in to KPH. KPH MRI machine has not been working since 2018. And we're in 2022 now. So if you go to KPH and need an MRI, you have to leave KPH. And if you're really sick, you have to be in an ambulance that you might have to pay for. And you have to go somewhere like Portmore or somewhere like that to get the MRI done, a private facility, then come back to KPH. So if you're a really ill patient, it's not the ideal situation to be moving up and down somebody that is critically ill like that just to get an MRI done. And that is what we are complaining about. And we have noticed that there's like a shift away from from investing in our public health system towards propping up private institutions and private individuals. So you find the policy now is that we are going to be outsourcing the surgeries for the most part to private hospitals. And we are going to be outsourcing some of the lab services to private labs. And we are going to be we are coming abroad to recruit nurses from the US or whatever at all expenses paid. And we don't know what is included in that. We don't know if it includes first class plane tickets. We don't know if it includes gym membership, transportation, accommodation. So you find what could end up happening is that those persons that we are importing will end up paying them more and compensate better than the nurses that are working here. And that I have a very serious problem with, because we have to start believing in our people and believe that we have the capability to manage the little that we have. Yes, Jamaica is a developing country, but we have many low-hanging fruits, as Dr. Guy would say, which is the senior shadow person on the PNP side, that we can definitely do much better with. And it's like just a question of priorities. And we have to understand the situation of many persons in our population. They cannot afford to find food. And for somebody who can't afford to find food, you can't tell them to find money for a procedure, especially if it's not affecting them right now. They are going to prioritize finding food to keep them alive today. So we have to ensure that we have a functional healthcare system, because everything else revolves around that. You can't have a functional and efficient society if everybody is sick or everybody is about to get sick because of how poor the public healthcare system is. So as it is right now, if you don't have the money to seek private care, you're in serious trouble. And I can give you another example as it relates to diagnostic care. If you do a pap smear privately at a private doctor and send it to a private lab, you can get back that result within 3 days the most, or a week, tops. 2 weeks in a bad situation. If you do it publicly, depending on where you are in the island, you can wait years to get back the result.
Years?
Yes, man, years. Years. And the same thing for biopsies and so on. So the management and the urgency is not there inside the public health system. And it's something that I think we kind of just overlook it, because, you know, most times, most people don't get sick, and most people get sick. Once they can avoid it, they don't go to the public system, and that is part of the problem. And management of the public system is also important, because a lot of time when resources are poured into the public system, it leaks right back out because of the poor management, and because you have persons doing private work in the public system and vice versa. So that is also something that needs to be managed too as well. But for the most part, we are not investing in our healthcare system. We should be ahead in our research and development. I use Cuba as an example, because Cuba has been on an embargo for over 50 years now, and they have a very up-to-date biotechnology department where they are produced all the vaccines that they use, including the recent COVID-19 vaccines that they are using now. And we have an open market. We can import from anywhere in the world, but we have not developed one, not one. So there's no push for us to be ahead in terms of diagnosing and developing our own methods and coming up with new drugs in our country, which we can, because we have the raw material already too. We have the plants, we have all of these things. So it's just for us to prioritize what is important, organize it. And I don't know if you want to go down that road, but
so what I want to ask about is, when I was living in Jamaica, they implemented free healthcare. Do you think this contributes to the problem that we're having now?
I would say yes and no. So while I believe in free healthcare, you have to put the money behind it, to support it. So give $10, when you make it free, you now have to give $200. You can't be giving the same $10 or even less, know that you have it free, because your health system is going to come under more pressure. So what we did, we just made a political decision to say free healthcare without any type of planning.
No infrastructure was put in
place. No infrastructure
to
support it. So there was no infrastructure in place to support it at all. And that sent the system under, because now what you have happening is that the quality of care that people be getting has decreased significantly. the workload of your nurses and your everybody has gone up exponentially, and that is a problem. If you're going to make free healthcare, you have to put in the infrastructure to support it, both from a human resource point of view and from an equipment point of view. You have to. You don't have a choice. Sometimes, as politicians, sometimes we jump and make some decisions because, yes, it might be a good idea, but the execution is also important because you can do a good thing at the wrong time and in the wrong way, and it becomes a disaster, even though you might have had good intentions. So that is what we're facing now with the free healthcare system and thing. But if we had done it properly, it would have been a beautiful thing to see it being executed and helping the most vulnerable, because that is the only way really we can really get the healthcare to those who need it the most. You know?
So currently, as it is now, if nurses are leaving, because sometimes I, watch some discussion going on in Jamaica, and that the Minister of Health is, we're going to do something to prevent the nurses from leaving. Is it legal? Can they actually stop a nurse from leaving?
That's a tricky one.
Because remember, the nursing program is not free. It's the government doesn't pay for it. So the nurses finance their own education.
Yes, the reason why I say it's a tricky one, and you never know how somebody in the government might be thinking.
Right.
Especially now the situation that we're in, we're the opposition, because we have only 14 seats inside Parliament. The ruling party can literally they have a free reign to do what they want to do. So the reason why I say it's tricky is because, technically speaking, nursing is one of the programs that is funded by the government, which means that it's subsidized by the government. So the nurses, the persons don't pay the full cost of.
Okay.
So what you could have happening is that the government could say, well, okay, since we are paying a portion of which I don't agree with, because I think as a government, if you have young people in the country, you should be, it's part of your duty to help to educate them, and if they have an interest in a particular area. It's also your duty to create the right environment for them want to stay, and want to serve the country and not be in a hostile environment. So I would not support any type of measure that would restrict, say you can't leave and so on. No, I wouldn't support that. What I would believe in is having a discussion and see if we are supposed to go ahead with full support now, full support and consistent support with all the additional benefits, is seeing what would be the best way. Just like how you have signed up for like the military, if you sign up for a particular period of time, there are some who do that too as well, and have that kind of discussion. I don't support measures where you kind of behave like you want to dictate to people, because you don't get the best results from people when you do that too as well. And they somehow always find a way around whatever you come up with. So, and it might encourage them to leave from even earlier. So most people study in Jamaica most times up until at least they finish high school and university, undergraduate degree. You might have pushed them to leave from early. So they say, well, okay, instead of me studying nursing in Jamaica, I just go the route of like heart, get a certificate and leave Jamaica from before, and then study abroad.
Even a few years ago, there were nursing students who were graduating from nursing school in Jamaica and were not placed in a job in the hospital. They could not get placed, and their student loan was still reaching out to them to pay back their student loan. How is it that there could be a shortage of nurses, but some nurses are not placed in the hospital system?
Because what the government has done, and you have the same thing happening, they have a case of that, cases like that with the doctors and other healthcare professionals, because what the government has, they have a limited number of posts that they have for the nurses. So you find, even though they have a shortage, they have, in cases you see where they have cut the budget. So even during COVID, they actually trimmed the budget right after we got through the peak of COVID, which didn't make any sense to me. But when you have the budget being cut, one of the first things where they cut is taking on more persons. So even though they need 100, they're in a way of cutting costs, they will take on 25 and just leave the others out there. So you do have nurses out there who have been registered, completed school, registered everything, and are unemployed.
So this makes sense. If you still have nurses in Jamaica unemployed, or they're gonna take nurses from overseas?
Yeah, but that is part of the, I would call it the hypocrisy of the system. It's almost like you're making a deliberate attempt to just ignore your own people. And how and the struggles that they went through to become yeah, some of these persons, you know, they're like the first person in the community to go to university, the first in the family. And when you don't value them stepping out on a limb and going against all the odds to complete university and to finish, and then you just leave them hanging with loans after that period of time. When they leave Jamaica too as well, which is also another problem, they do not want anything at all to do with Jamaica.
True.
Government. They are so turned off by how the system here in Jamaica treat them that they don't want anything to do with Jamaica. So we have a large number of persons in the diaspora who just don't have anything to do with Jamaica. And if we had a good relationship with those persons, they could be the same ones who would help us, and they'd be willing. I have a lot of willing persons in the diaspora willing to volunteer, willing to send back equipment and all of that, willing to do a lot of things to help us. But because of how we have deal with them in the past, they're not as interested. They want to have a total disconnect from Jamaica.
Yeah, right.
Don't have anything to it, which is also a problem that we have.
I just want to share a story. When I was in Jamaica, I wanted to become a nurse practitioner, and I applied to University of the West Indies to do an NP program. And they called me in, did the interview, but then they told me they did not have that program readily for people who were not midwives. So in order for me to become an NP, I have to go and do midwifery course, and then from there to become an NP. So I said, I don't want to be a midwife. I just want to do like family nurse practitioner. I don't want to do anything to do with OB. And that was not available. So she said, I told her, okay, I'm going to go overseas and do my NP, and then I come back. And she said, you still won't be able to work in Jamaica. So I'm one of them who will never come back.
Yeah.
Yeah.
And that is just some of the bureaucracy and red tape that we have in our system. You know, and it shouldn't be like that. And that is when and this is the thing, you have persons here that we don't encourage to do what they need to do, and we try and the red tape and all of that hold them back. And then when these persons get the opportunity abroad, they are welcome. They grab them up abroad and they flourish and do so well when they reach abroad. And then you say to yourself, this is a first world country, and they're doing so well here, but yet still when they're right here on our in their hometown, basically, it's not the same.
It's not the same.
So, you know, that is something that we definitely have to work on. And one of the serious problems that we have into most times you're dealing with young people, because these are young people that just finished university and to go in. And when you deal with them like that, it can have long-lasting impact, which is part of the reason to why our population is declining so rapidly.
Yeah.
Those
I'm gonna check. Hold a second. I'm gonna check if there's anybody on Facebook. Might get a feedback. Let me silent. Okay, I don't see any comment here. Yeah.
Yeah, so it's something that we really have to look into, and I think it's something that we can do, and we can afford to do it, and we should. We don't have any choice. We're getting to a point now where we don't have any choice at all, because it is a lot of people have been dying, a lot more persons will die if we continue this path. It's just not sustainable for us to keep doing that.
So as nurses in America, for those of us who have left Jamaica, what suggestion do you have in place that we could help? How could we help the situation in Jamaica?
All right, so there are several ways. I know that sometimes when you're abroad, you have access to like medical missions that can come back to Jamaica. That is one very practical way of helping. So if it's so for example, if a particular community knows that every 6 months, eye mission, for example, you know, that will come and focus on eye care or focus on dental care, would be coming, or whatever it is that they decide to focus. If it's even screening for a particular cancer that we have a high rate of inside Jamaica in a particular area, all those things, those are practical ways that can help. Also, I believe that in terms of both our education and equipment. So there are some persons who have access to to state-of-the-art equipment or could reduce the cost of some of the state-of-the-art equipment in terms of sending those back to Jamaica. And then also conducting training. So we have nurses who are well-trained abroad that even if they come down for a week or so, they could do some sort of training with nurses who have an interest in a particular area that they specialize in. So those are areas that we can work on. We have nurses like yourself who work at universities and so on that they can help. There are areas that they can definitely help with. Where we need to get to know is organizing it. And I think this is one of the suggestions that I also made, is for us to have a fund for persons in the diaspora. So once you're outside of Jamaica, it could be Caribbean country, first world country, Middle East, wherever you are, where once you contribute to that fund, it's not necessarily managed by government. Yes, you'll have a government member represented on the board, but it's not necessarily managed by them, because some persons have an issue giving the government any more money because they feel like they're not managing what they already have. And I'm sure we can find a group of persons in the country that are responsible and respected by both sides. And you put them on this board and they manage this, and they take on specific projects that deal directly with the people. And notice I emphasizing deal directly with the people, because sometimes when things go through the vine and by the time we get to the patients supposed to serve, they don't benefit from it any at all. And I'm telling you, I'm 100% confident that persons in diaspora are willing to donate to that once they see the work that is being done with the funds that are donated, and you have full accountability with it. They will to do that. So, and I will split the funding in how it's work. I would split it 60% for education, 60% for healthcare, and 40% goes towards education, because you can't really have good public health without a good education background foundation. Because persons won't be able to comprehend the message that you're, and they won't necessarily be able to read it too as well. The education is also just as important as the healthcare. So that's how I will split that. It goes towards specific projects for specific communities. So that is one way we can go about helping to as well. Because there are a lot of resources in the diaspora.
You mentioned about equipment. I know that there's been a history of equipment being sent to Jamaica, but there's no maintenance. So that has been a sore area.
Yeah, that is also a problem. Maintaining the equipment that we get. It has been a sore point, and that is why most times we push them until they stop working, and then
they're just done.
And then, you know, so yes, the maintenance is also very important. It is something that we should definitely look forward to. When you get into certain agreements with some companies, if you're buying the equipment or you're leasing it or whatever the case might be, they normally have a maintenance schedule, which is something I think that would suit us, since we are not go out of our way to maintain the equipment. When you have it on a schedule like that and you just pay for it as one package, it would be cost effective, and that you have running equipment all the time and using the right equipment for the right thing. Because sometimes we pressure the one thing so much and we use it to do things that is not necessarily meant to be used for, and then you end up with it malfunctioning. But yeah, absolutely.
I think Jesse, the maintenance shouldn't be that bad, you know, because I was also a dialysis nurse in Jamaica, and none of those machines were made in Jamaica. So Fresenius is one of the main ones, and they would send their team to Jamaica to train technicians down there. And then ever so often, maybe like 2 times for the year, they would come down to Jamaica to do like a big general maintenance and do additional training, new stuff that the technicians know. And if a machine breaks down and the technician in Jamaica can't fix it, they just call Fresenius and they stay right there on the phone and troubleshoot that machine. So a proper maintenance team would have to be put in place to train local people to do those specific jobs.
Yeah, man, absolutely. And it can be done. I would say just the will to really organize it and to put once you realize the importance of it, you know, it changes everything. And sadly, most times we wait until they're sick and end up in emergency before they realize that, okay, this is really a problem. Because tell people, if you think I'm being extra exaggerating, just go to any emergency room, ER in the country, anyone in hospitals, and realize you have the ER is like a ward now, and you have male patients mixing with female patients, and in the waiting area you have persons being admitted and they're sleeping on chairs and bench and on yoga mats for weeks, and some people are admitted and they stay there and they die there on the floor. you know, and it's not an unusual sight. And the A&E is so crowded that if you go in with a particular, you might go with a broken leg, for example, you end up catching COVID, dengue, and all the other things that whatever infectious disease they have inside there too as well, because of how close you are to all these other persons. It's just one big crowd, everybody breathing in everybody's breath, and it's just chaos in the end right now. And you can end up being there waiting a day before you even get to see a doctor. You know, so
Wow.
it is really a very grim situation.
This is really, really heartbreaking because I didn't know it was so bad.
No, it's really bad. We were at Connor Regional Hospital recently. You know, they're doing renovations for 6 years now. And they haven't reached anywhere. I don't think they're finishing anytime soon. But when you look at what they put in place to substitute, you have a waiting area. Part of the waiting area is they just have a tent. We
Okay.
don't have proper cooling inside the tent. Is the flooring is asphalt, so they never even build up like a little floor in a whether you put board and then put something over it, whatever the case is. So if you have body fluids being spilled, you can't clean it properly because it's on the asphalt. You can't
Right.
wipe properly or whatever, and things like that. So it's extremely hot and uncomfortable for patients to be waiting in that type of situation. So it's just
So what about medicine? Yes, I know that there's a shortage in personnel. What about the medication? Are medications available?
It's a good question. So sometimes you have shortage with the drugs that are subsidized by the government, like those who have the NHF card and all of that. But for the most part, that hasn't been a very, very big issue for the most part. So this is the thing. If you have the money to pay full cost, you can always get most drugs that you need. The problem is when now you have to go through the system to give you the different drugs that you need, where you might have some problem of having issues getting the drug that you need. And sometimes hospitals are at a point to where normally you go to a hospital and whatever you need, especially if you're admitted, you get it there. Where we're at now in the hospitals that sometimes they give you a prescription. So you have a broken leg, and you need the screws, they give you a prescription and send it to go and buy it. You need a particular drug, they give you a prescription and give one of your family members to go and get it to come back. So it's almost like it's not a case where everything's at the hospital and you just get it you need and then you leave. So a lot of times that is what's happening. And if you have somebody who don't have anybody looking out for them, it can be very, very difficult for people like that.
So you can be okay in Jamaica, you can do well in Jamaica, but just don't get sick.
Precisely. And that is, I think, part of the problem too, is that I believe if more of our leaders if they were using the health facilities that we have, experiencing the care that the regular population gets, they would have some sense of urgency in terms of fixing what is there. And I always tell people, even though you think you can always just fly out or whatever, the case, you might have a serious emergency where you're not able to leave.
Right, that's true.
Or you're not well enough to be lifted. So that's something to keep in mind, and accidents can happen anytime.
Okay.
Where? So we have to make sure that we have a functional system so that you are comfortable with using the system
that you have in place.
Yeah, you're comfortable with the skill level of the person that you have in place for both yourself and your family to use, because everybody is using it, so you should be comfortable using it too as well. So
yeah,
something that we have to pay attention to.
Well, Jesse, we will definitely be following up with this conversation. You have shed a lot of light on these and what's going on in Jamaica. You know, for us who live overseas, and we might visit for a couple of days, and we didn't go to the hospital to see what's going on there, but we still have family members there, and you know, we still are pretty much a part of Jamaica. And I really appreciate you taking the time to come and discuss, and you have discussed some very, very interesting points. And for anybody who is watching or those who will watch this later on, put your comments in, and at any point we can, bring back Jesse to discuss this some further.
No problem. It was a pleasure being here, and it's always I'll make myself available whenever you need me to be.
Yes. All right. Thank you so much. And I'm gonna end by saying, as long as you're alive, we live, we laugh, we love. I'm gonna put in help others whenever you can, and travel. Okay. Have a great day. And this was Health Talk with Dr. Morgan, and my guest today was Jesse James Clarke. Junior Shadow Minister of Health and Wellness, People's National Party in Jamaica. Thank you.
All right. Thank you too. Take care.
Bye-bye.
All right.